everyone. I'm Dr. Maryam Lustberg. I'm Chief of Breast Medical Oncology at Yale Cancer Center. I'm one of the editorial board members in Breast Cancers Today. I'm so happy to be here today to talk to you about updates in breast cancer from ASCO 2025. So DESTINY-09 is a very important study that builds on a body of work showing that T-DXd has tremendous activity in HER2 positive breast cancer. And so based on the tremendous positive results of the DESTINY-03 study, where T-DXd was evaluated in the second-line setting, the rationale was that perhaps moving this up to that front-line setting, we could even have greater gains by providing our patients with this highly effective therapy up front. And then the rationale for the arm containing Pertuzumab combination is based on really strong preclinical and early phase models showing that Pertuzumab and T-DXd can have synergistic activity. So essentially a new way of delivering dual HER2 targeting therapy. Yeah, so DESTINY-09 showed that the median progression-free survival was around 40 months, which is quite impressive. The control arm in the study was around 26 months. So compared to the Cleopatra regimen, at that point, that was read out initially as about 18 months. So clearly, depending on which control group you look at, an approximate doubling of progression-free survival advantage. So I think there's great excitement for this regimen, but we also have to take into account greater potential for toxicity and really kind of think about how to select the best patients for this more of an escalated approach and kind of think about future clinical trial designs that look at maintenance therapies so that patients are not simply taking T-DXd until their next progression. So these are, like any good study, it will lead to additional studies to fine-tune kind of the regimen that we would end up with. But I still think the results are exciting, and it is an advance for our patients with HER2-positive metastatic breast cancer. Benefit was seen across all subgroups on initial presentation. I think additional analysis will be done looking specifically on time to development of brain metastases, presence of brain metastases, as well as predictors of early response and early resistance. One biomarker that will be looked at would be the PI3K C pathway in these HER2 positive tumors. So there's a rich number of correlatives that we can look at to better understand the subgroup of patients that kind of need more of this upfront escalated approach, plus also patients who may not need as much, who kind of did well regardless of which arm of the study they were on. So I think one of the benefits of the DESTINY-09 study is that we will be able to, over time, explore kind of these associations. But right now, I think it's too early to reach any conclusions. As we expected from prior T-DXd study, there were higher rates of interstitial lung disease. All grade toxicity of ILD was approximately 12% in this study, which was certainly more than the control arm. Unfortunately, there were also 2 deaths that were attributed to ILD, so this is something that we do need to be quite careful about. There was also numerically higher rates of cardiomyopathy that was seen in the T-DXd Pertuzumab arm, but no deaths reported with that. So I think it's a very exciting time for our patients and clinical researchers in HER2-positive breast cancer. I think we all generally agree that continuing T-DXd indefinitely till progression is probably not going to be the approach that most patients will need. So I think follow-up studies will probably explore some type of an induction period where patients are getting certain number of cycles of T-DXd, and then if they've had a great response, perhaps they can be de-escalated based on hormone receptor positive disease or not, to maybe some type of a combination CDK4/6 inhibitor plus HP. That would be one type of design, and then patients who are hormone receptor negative essentially continuing with HP or some other type of targeted therapy. So all of these, I think, will be pitched and assessed in terms of what that next study looks like. I think in the real world right now, I think kind of going off script is probably not my preference at this point. So I think kind of when we're ready, I think we will see guideline change relatively quickly with DESTINY-09. So in my practice, I plan to discuss the findings with my patients, discuss the toxicity differences between THP and T-DXd plus Pertuzumab, and kind of utilize shared decision making. And then I generally think patients who are in general good health and have a lot of disease, I would favor upfront T-DXd Pertuzumab at this point based on this data.